All right, Trudy, I'll hand it over to you.
Thank you, Raquel. Hi, everyone. So thank you, Raglan, for your acknowledgement of Ngunnawal country earlier this morning. And I also did want to say that I am Victorian, born and raised. And so my heart has been very much with all of you Victorians, particularly over the past little while with the situation down there. And yeah, we've all been thinking of you and hope that you're travelling okay. So I'm the Director of Preventative Health and Renal Health Policy in the Department of Health in Canberra, in the Indigenous Health Division. And basically what that means is that I manage the TIS program. I also look after nutrition and physical activity and renal policy and a few other projects that don't necessarily relate to my title. We have a small team of committed workers. We have lucky enough to have 2 Indigenous staff out of a current number of, I think, 5. We've just had a few staffing changes recently. Yeah, thank you, Ben. So what's happened over the last year? Some of you may be aware that the ABS produced updated data through the National Aboriginal and Torres Strait Islander Health Survey 2018-19, and what it showed in terms of smoking was that around 4 in 10, or 41% of Indigenous people aged 15 years and over were current smokers, 37% smoked every day, and another 3% smoked but not every day. The proportion of people who smoke every day was 4% lower than in 2012-13, which might not sound like a lot, but it is actually equates to quite a number of people. It's about the same for men and women. It's higher for people living in remote areas at 49%, whereas in non-remote it's 35%, and it's lowest for young Indigenous people. So 15 to 17 years, it's only 10% compared to around 40% for all other age groups. And people aged 15 years and over who smoked every day smoked around 12 cigarettes a day. Thanks, Ben. So out of all of that, the good news really is that the proportion of people aged 18 years and over who smoked every day steadily decreased in non-remote areas from 49% to 37% over the past 14 years. And the proportion of young people who had never smoked between 2012-13 to 2018-19 increased from 77% to 85%. That's in the 15 to 17 year age bracket, and from 43 to 50% for those aged 18 to 24. So that's really good news, particularly for young Indigenous people and the up and coming generation. And I guess one of the goals of TIS is to try and make sure that those young people don't ever pick up cigarettes or the habit of smoking. The bad news, as I've mentioned, is that people in remote areas aged 18 years and over who smoked every day did not change significantly from 2012-13. Thanks, Ben. So what else has happened? We, because of the data around remote, we looked at ways in which to try and invest more, improve outcomes in those areas. And after consulting with a range of stakeholders on what we should do, ended up getting the advice that basically there's no reason why it's not an intractable issue. There's no reason why we can't bring the numbers down in remote areas. We just need to have a bigger footprint and have more intensity of services. So we funded 3 new sites and provided additional funding to Congress. So we funded IUE to do the Tiwi Islands. And the reason why IUE received that funding, which is a Queensland-based service, is because they were already doing some work in Tiwi Islands up there with their Deadly Choices program. The Torres Strait, so that's really exciting that we're now going to be reaching into the Torres Strait, and Worley in Catherine. We've commissioned Circa, who does the normal TIS evaluation, to do a more in-depth evaluation of those remote sites, so we can really understand what's going on in remote and why, what are the reasons from an evidence-based perspective. that the rates have stayed high when it's dropped everywhere else. And we've funded NBPU for some dedicated work in remote areas, and they now have a staff member who's entirely focused on remote, and that's Ben, who is our Zoom coordinator today. So congratulations, Ben, on that position. Next slide, thanks. Because of what's going on in remote, we had discussions with Professor David Thomas, who's been mentioned previously by Raglan and Tom. He's an expert in Indigenous smoking, both nationally and internationally, and he's based at Menzies in the Northern Territory. And he approached us because he's involved in Northern Territory government work around smoking. And as most of Northern Territory is remote, apart from Alice Springs, they wanted to do some really dedicated work there. And so we have a partnership forum in every state and territory. So Victoria has one as well, where it's state government and the Commonwealth government and the peak Indigenous health body and primary health networks and the NIAA. So there's one of those in the Northern Territory, and under that we've established a working group to focus specifically on tackling Indigenous smoking in the Northern Territory, and we expect that there'll be some learnings that will come from that and tools and resources that will be able to be more broadly applied across other remote areas in due course. Thanks, Ben. We also convened a smoking and pregnancy roundtable in February, which seems like a million years ago now, and it was chaired very expertly by Tom, Professor Tom Karma, and we had about 35 participants, and about 15 of them presented. They were all people who either work in this field in academia or deliver programs in relation to tackling pregnant women who are Indigenous who smoke. And it was a very rich production and dissemination of information, and was really interesting, and there were lots of common themes that emerged. And so basically that we need more trauma-informed approaches, we need more wraparound services for Indigenous pregnant women, and we need better education for health professionals who come into contact with Indigenous pregnant women who may be smoking. And we have produced a transcript of the day. So it's basically a report that's almost verbatim what actually was presented and discussed on the day. And we've also videoed all of the presentations, and that's all now available on the TIS RIC site. Thanks, Ben. In terms of governance, there was an advisory group that was just for the NBPU, but it was decided that that's all up and running now and doesn't particularly need an advisory group in itself. And so that was disbanded and a new group was formed. It actually provides advice to TIS as a whole, and Lionel's on that group, which is really great. We've only met once, Tom chairs it, but we're meeting again soon, I think. And then you will all be aware that a while ago now, Circa finalised its performance reports and activity work plans and templates and the monitoring and evaluation framework. And we did a data variation to change the reporting timelines. Thanks, Ben. We've continued to work with ANU, so that's Raglan and his colleagues on the work that he just discussed with you. As we fund that, Circa on the evaluation, Tom, we work very closely with Tom. He has an office on our floor, and we catch up with him at least every 2 weeks, or if not more often. And so we're always in contact with him and discussing things with him, which is really fantastic for us. Quit lines, which we have unfortunately probably not given enough attention to over the past while, and so we're ramping that up a bit now, and we've got a meeting with all the quit lines coming up on the 30th of September, which Tom will chair. the Quit Skills, who's a new program manager, Sarah Aegis, and she's got some great ideas about where to take Quit Skills from here. So we're working with her on that. We have a good relationship with the DES Community Grants Hub. We know that that's not necessarily an ideal situation, that a whole different department looks at your activity aware plans and progress reports, but we have a good relationship with them. We have trust in them and their work, and we try and make the best of that situation. And we funded the University of Newcastle to deliver ISIS to Quit about 18 months ago now, and we've just received news from them that they've recruited 25 sites, which is really exciting, and 11 of them are mainstream. Thanks, Ben. In terms of COVID-19, so when COVID first started to really hit, we were starting to get requests across the board in the Indigenous health program for resources to be reallocated to the COVID frontline response. We also got those requests specifically in TIS. We made a decision as a division to allow it on a case-by-case basis, but as it's turned out, most Indigenous communities have been very well safeguarded from COVID, and we have found that there hasn't necessarily been a great need for that reallocation of resources, and where that has happened, we've asked that now return to focusing on TIS again, and also focusing on TIS we think is focusing on COVID-19 response in terms of people who smoke being at potentially greater risk in terms of health issues and compromised immunity and sharing of cigarettes and those sorts of things. And we know that BARS has done some really fantastic work with their masks, and yeah, so we've been really excited to see some of the innovative and ingenious ways in which people have, TIS groups have responded to COVID-19. Thanks, Ben. What are our plans for the coming year? We've just started a little underspends project. We've had a look at underspends. We were kind of taken off guard, taken by surprise recently with an organisation not in Victoria that had been carrying a significant underspend for a couple of years and had to return it to consolidated revenue. And we had no visibility of that, partly because of the DSS health situation. And so what happens when money gets returned to consolidated revenue is that it's lost to Indigenous health. It goes back to government and they can spend it on whatever they want. And that's absolutely something that we want to avoid at all costs. So we're now monitoring underspends more closely, and we'll be targeting organisations that we can see are carrying underspends and have been carrying them for a while. Our strong suggestion is, and particularly in this time of COVID-19 where, and it might not be necessarily the case in Victoria, but in other jurisdictions where a bit of travel has been budgeted for, and you know that you can't use your travel budget, spend it on something else. Sort of, you know, be a bit preemptive that you're probably not going to use that money and reallocate it to something else, because we've lost in 17-18, not in a COVID time, $425,000 to consolidated revenue, and last year 260,000. Now, TIS is funded to the many millions, so in the scheme of things, but that's still, when you add it up, you know, that's still a lot of money that could have gone towards tackling Indigenous smoking, and we just want to see no underspends. And if people are having trouble figuring out what to allocate funding to, or figuring out how to spend their full budget, have a chat to the NBPU. They've got lots of ideas that they can work with you on in terms of implementing things that the funding can go towards that are meaningful and evidence-based and best practice. Thanks, Ben. So what else are we planning on doing this year? Well, we're going to continue to focus on remote and pregnant women. We'll do continuous quality improvement, as I said, through quit lines, giving more attention to them, quit skills, working with Sarah on where to from here with quit skills. the MBPU is doing a thematic review of activity work plans. So they're basically looking at all of the activity work plans and providing an analysis on, you know, what teams are doing, what they tend to be focusing on, maybe what they're not focusing on, that they could be focusing on, just looking at themes and just provide a bit of an understanding, a more in-depth understanding of the work that's going on out there. And we'll continue to work productively with stakeholders and identifying the best use of resources, given that we've got a year and a half left of the program. So we'll also be looking to see what happens after the next 18 months and making some plans in that regard as well. Thanks. And thank you for allowing me to present. And does anyone have any questions?